They know a lot about chikungunya. Firnell, Eden, and Ryeley explain.
Welcome back to Microbiology 223, where we learn about microorganisms, microbes, and everything in between. Today, I have with me Dr. Butler and Dr. Bethel. Today, we will learn about a mysterious disease,
the Chikungunya virus.
Have you been exploding the toilet recently?
Do you have a rash that's irresistibly itchy all the time?
Are you hearing secret voices that go like?
It's a tiny threat with a big bite looking for any source of blood. This agent is the Aedes mosquito, also known as the vector
of the Chikungunya disease.
Surrounded by fresh bodies of water, can you believe that the Bahamas is a breeding ground for the Chikungunya disease? The sunny days and the warm weather is deemed a perfect home for this viral agent. Let's learn more about this disease from Dr. Bethel.
Chikungunya is a mosquito-borne disease caused by the Chikungunya virus, which is an RNA virus in the alphavirus genus. Alphaviruses are known to impact the brain and nervous system. Another example is the Venezuelan equine encephalitis or Ross River virus. CHIKV is contracted through the bite of an infected mosquito, and most immediate symptoms include abrupt fever and severe joint pain that can last for months to years. Other symptoms include rash, joint swelling, fatigue, and nausea.
Let's meet the vector of the Chikungunya virus. The Chikungunya virus is spread by the Aedes mosquitoes, mainly Aedes aegypti and Aedes albopictus. They tend to thrive in warm, humid environments and breed in stagnant water. They are often found in places like old tires, flower pots, buckets, and uncovered water containers around homes and yards. Unlike most mosquitoes, Aedes are active during the day, especially during the early morning and late afternoon, making them harder to avoid. The transmission of chikungunya happens when a mosquito bites a person who is already infected with the virus. After a few days, the virus multiplies inside the mosquito, and when it bites another person, it passes the virus into their bloodstream. This cycle allows one infected mosquito to spread chikungunya to several people. What makes the Bahamas an ideal home for this vector? In the Bahamas, several factors increase the risk of outbreaks, including frequent rainfall and flooding, poor water drainage in some areas, outdoor lifestyles, and traveling in between islands and countries. Many people do not realize that they are unintentionally creating homes for these mosquitoes, such as in site number 2, garbage cans, site number 3, pet pools, and also site number 5, pools in their backyards. All of these sites can cause mosquitoes to live there and breed in the environment, which can cause the risk of an outbreak. With the risk of a warm climate and seasonal rains, mosquito populations can grow quickly, especially in communities where water is stored improperly or left standing. This makes mosquito control and personal protection essential to reducing the spread of the Chikungunya virus.
In the Bahamas, there have been 3 significant outbreaks of chikungunya. The last recorded and confirmed case of chikungunya was in 2019 in New Providence. The last recorded outbreak of chikungunya in 2016 brought about 75 probable cases of chikungunya in the Bahamas and 1 confirmed case. Before this, in 2015, there were 10 laboratory-confirmed cases of chikungunya. The first outbreak of chikungunya happened in 2014 and brought about 92 laboratory-confirmed cases, according to the Pan American Health Organization. Persons most at risk for serious health complications from chikungunya include young babies, the elderly, and older adults with underlying chronic health conditions. Chikungunya is particularly active during the summer seasons, where there is most rain in the Bahamas.
Dr. Nima here with some protection and prevention tips that you and your loved ones can take to safeguard yourselves against the vector of the chikungunya virus.
Chikungunya Safety Checklist. How to avoid getting bitten. Use mosquito repellent on skin and clothing. Wear long sleeve shirts and long pants, especially at dawn and at dusk. Stay in screened or air-conditioned rooms. Sleep under a mosquito net if your room is not sealed. How to control mosquitoes at home and in the community. Empty and clean containers that hold water, such as buckets, tires, and flower pots. Scrub the walls of water containers to remove mosquito eggs. Help keep drains and gutters clean and flowing. Report mosquito-infested areas to local health authorities. What to do if you feel sick. Watch for symptoms such as high fever, severe joint pain, headaches, and rashes. Stay at home and rest. Do not spread the virus. Drink plenty of fluids to avoid dehydration. Visit a local clinic or health center as soon as possible. Lastly, keep using mosquito repellent while sick so you do not infect more mosquitoes.
Many public health officials gave updates about the chikungunya virus to publicly watched sources, such as ZNS Broadcasting. For instance, the Bahamas Department of Environmental Health highlighted its screening of the Aedes aegypti mosquito at all ports of entry in the Bahamas. They provide preventative measures, including the removal of pots, pans, and buckets filled with water around outdoor areas. Fog machines at sites were also used to control the chikungunya carrying mosquitoes. Larvicides or adulticides were added to water systems to reduce the amount of moisture and mosquitoes present. Getting rid of debris was also encouraged by these health officials. The Department of Health has started testing amongst population to rule out how many infected individuals were present in each area of the Bahamas. Former Deputy Chief Medical Officer Dr. Dalton Brennan has stated that everyone is on high alert. More testing is being conducted, screening of more patients were carried out, new technology was being produced for rapid testing. Additionally, mosquito indexes, which is the measure of infected mosquitoes, were also carried out. Health officials encourage individuals that if they're feeling symptoms, then please contact and visit your nearest local clinic. At the time, Health Minister Dr. Perry Gomez reported new cases of the chikungunya virus to keep the public involved and informed about what was happening in the Bahamas. The Ministry of Health also updated their website to inform the public on the disease, the symptoms, the origin, as well as protective measures that they can take against this virus. Additionally, they included research from international well-established organizations such as PAHO and WHO for extra information. Thank you once again for tuning in.
And remember, remove all outdoor water sources.
Wear cool long sleeves in the summer.
And stay safe, Bahamas. And remember,
A few moments later. An eternity later.
We're alone. I feel like that's the cat.
Which one?
Dr. Butler and Dr. Ryeley. Dr. Butler and Dr. Ryeley.
Dr. Butler and Dr. Ryeley.
Oh, sorry.
And action.